fountain of youth may be leading straight to your eyes. Are your peepers making you look a little older than you are? Well, there is a quick fix, and our Dream Team skin editor, Dr. Michaels, is here with a few procedures to, we all want to do this, turn back the hands of time. And you know what? As I'm getting older, too, I'm realizing eyes, people focus on some other things, but they can really age you.
Oh, no,
one of the most, get the bags.
One of the most major things, or actually, it's a very quick fix to be able to get that better. I think we were all watching the Golden Globes last week.
Yes.
And I'll tell you, one of the things that viewers need to understand is that these people have teams of people that really take care of them, from their hair to their face to their clothing to their accessories, you name it.
Yeah, you can't compare.
And in fact, I'm not sure if you saw where Tina Fey had said that she felt like she was a Macy's Day parade balloon being tethered up by about 25 people. So what I want to be is the personal advisor to our viewers for the skin, but particularly today, the aging eyelid skin. And the reason I want to talk about that is that that's probably the number one, or one of the number one complaints that I see at Aspire. People coming in with the fact that their eyelids look aged more than they actually feel. And you know, that stinks. You know, no one really wants to have aged eyelids if it's actually fixable. Now, in the past, I've talked about Botox, I've talked about fillers to try and correct some of these things. Those are nice little maintenance therapies, but there also becomes a point at which surgical correction is almost necessary.
Is what you really need to do the proper fix, right?
You actually have excess eyelid skin. We call that skin laxity. You have excess bags under the eyes. Sometimes you have to sculpt the fat pads out of there. And so what we do at Aspire is a procedure called CO2 laser blepharoplasty.
Okay, so we've got a picture right here. Explain what we're looking at, doctor.
Okay, so this is someone that had their upper eyelids actually treated with the procedure, and you can see they had this lateral hooding, excess eyelid skin, and in the follow-up picture you can actually see their eyelashes again. This is another patient that had the same procedure done, CO2 laser blepharoplasty, and one of the advantages to it is that because I'm using a laser, it allows me to stop the bleeding at the same time as I do the incision, so there's much less bleeding, much less bruising post-operatively, and the recovery is about 7 days. It's very quick, and it's very simple. I think the thing that's also amazing is patients continue to come in absolutely amazed at the absence of pain and discomfort associated with the procedure.
Really?
It's a very simple thing to do.
I would be worried about anything around your eyes. People worry about kind of procedures or cutting or lasers, but that's not a concern at all.
You know, it makes a dramatic difference in a short period of time. It's under local anesthesia, so there's no general anesthesia involved, so it's a very safe procedure to have done, and you get back up on your feet in no time. Now, for patients that are interested, I am going to be giving a dinner lecture at Brio at the Town Square on February the 1st.
Okay.
And if they're interested, just call Aspire at 588-7447. I'd be glad to talk to them about it. They'll get a lecture, a nice dinner, a dessert, ask me questions, and they can find out more information about it.
So that's a good opportunity not to have to go into the doctor's office, but a really just an easy way if you're interested about these procedures and just in a casual setting. That's a great idea.
Very informal. Now, like I said, I can be the personal advisor for everyone's skin, making them look youthful and vibrant, just like the Hollywood actresses and movie stars. But if you ask me about hair or dress, you can forget about it. Can't help
Which
you on that
accessory
one.
to wear, or
Can't
what dress to go with. Yeah, that's all right. Well, listen, if we have the great face, every dress looks good, right?
Absolutely.
That's the best canvas.
That's right.
Let me ask you, is there any truth to the myth? I think we always hear, if you don't get enough sleep, you're going to have bags or dark circles. You know, are there things we can do to prevent before we go into the night when we're, you know, in our 20s and our 30s to make that less apparent?
There's a lot of preventive measures. I mean, certainly there are topical medicines that we know that stimulate collagen production that can actually help with conditions like that. You know, I think genetics is a very big factor when it comes to eyelids, unfortunately. And but again, you know, it's not a very big procedure to have done. I want people to understand that although they get scared about things like this, you know, if it's done in very skilled hands, it can be done very simply in a relatively quick period of time. I think one of the things that people get nervous about is sort of the old jobs of old, where people have these just bright-eyed, too much skin taken out, and so moderation is the key. You want to look good, you want to look beautiful, approachable, but you don't want to look overdone.
Exactly.